During this EHA 2024 annual meeting, I had the privilege to chair and moderate a special symposium dedicated to immunotherapy, especially bispecific antibodies in relapsed refractory multiple myeloma. And we went through the overall landscape, and today immunotherapy is really booming in multiple myeloma and really modifying the natural history of the disease and improving the outcome of patients. Whether you consider the CAR T cells, the two approved constructs, ide-cel and cilta-cel, now these two constructs are moving into earlier lines of relapse. We have also off-the-shelf with excellent results, the bispecific antibodies, the anti-BCMA, namely Teclistamab and Elranatamab, but also Talquetamab, which is targeting GPRC5D. We have also Cevostamab targeting FcRH5. And today, when we look into the BCMA targeting bispecific antibodies, we have a robust 60 to 65% overall response rate, mostly CR and VGPR. These responses are achieved very quickly, very early, median 1.1, 1.2 months after starting the drug. And most importantly, we are able, I think, in routine practice to have longer cycles. And this will help, I think, the quality of life of the patient, but also is likely decreasing the incidence of opportunistic infections, in addition, of course, to the wide use of immunoglobulins. For instance, whether you consider Teclistamab or Elranatamab, after 6 cycles and achieving a CR or very good response, you can switch into twice monthly administration, and now more and more people are switching to every month's administration. And actually in the Magnetism MM3 registration of Elranatamab, patient over the long term were switched into monthly administration. Talquetamab is also a very good, important player because it is allowing to salvage patients who failed actually the treatment with an anti-BCMA directed agent, whether CAR T cells, whether bispecific, but also even an antibody drug conjugates like belantamab. The only issue with Talquetamab is about some of the side effects like dysgeusia, mucositis, skin and nail abnormalities. But again, there are also good news. We are able to circumvent this by maybe reducing the dose, but most importantly by also having longer cycles, allowing to the recovery of the epithelial cells. So clearly now with the approval of ide-cel, cilta-cel, Teclistamab, Elranatamab, Talquetamab, we have in hand a wide variety of highly effective and tools with a well-established known safety profile, with some very well-established guidelines and recommendations on how to optimize the ratio of efficacy and safety. And all of this is contributing definitely to the improved outcome of multiple myeloma patients. Clearly, having a relapsed refractory advanced myeloma patient is not anymore a death sentence, because patients receiving these immunotherapies are able to live now longer and longer with a good quality of life.